With improved techniques in knee replacement, with improved techniques in pain management, you don't require painkillers for too long. Again, this is a very subjective thing. Most patients are on some kind of painkillers for at least 15 to 20 days post surgery. Some patients may need little longer. Again, this is a very subjective thing. It differs from patient to patient, but with, as I said, with advanced techniques in doing the surgery as well as advanced pain management, your requirement of pain medications is much lower compared to what it was earlier on. But I would put it as maybe around 20 to 30 days you will need some pain medication. I ask my patients to decide on themselves that if the pain is more, you take your pain meds more. If it is less, you gradually go on reducing it. And I tell them that if, as long as the pain is bearable, try to avoid taking pain medicines. You can reduce the pain by doing icing, and most patients are very happy to do icing, and their pain is much lesser with icing. The ACL, as maybe you are aware, is a ligament inside your knee joint, which we need to sacrifice when we are doing a knee replacement. Sacrifice in the sense we cut it and we remove it. Most patients with arthritis, the ACL as such is worn out or degenerated, so it doesn't have any function left, and the function of the ACL is taken care by the implant design. So this is like asking me how long my car is going to last. So it's just not how the knee is going to last. It also depends on how you are going to use your knees, right? So if you are not doing your exercises well, if you're just putting on weight, it is not going to last as long as you want it to last. On normal things, normal scenario, when you're doing everything in the right way, your knees should last you at least 15-20 years without any issues. And that's with the normal standard imported implants. There are newer implants which the company people say have a longer life because of newer technologies used in the materials. We have been using such implants and it is giving very good results. Though it's too early to say, because it's like 30 years is what the company has said these implants will last. So it depends on what kind of implant has been used and how the surgery has been done, and third, how you use your new joint. So ideally speaking, it will depend on what's your age, what's your activity level, and what you expect from your new joint. Depending on these criteria, your surgeon may give you a choice, or he may use what he's been using on a regular basis. Most of these components are made of cobalt chrome alloy, that's a kind of a steel, and titanium, and in between the two there is a plastic. And now with the newer implants, the plastic comes with added antioxidants, or there are some changes made in the manufacturing so that the plastic lasts longer. Some patients do have metal allergy, and for such patients there are different kind of knee implants which are available. Like there is the zirconium knee, which doesn't induce metal allergy. So depending on your specific needs, which you need to tell your surgeon, the surgeon can help you choose the kind of implants which will be good for you. Like for younger patients, we would use a different knee implant compared to a little older person because of the life of the implant. And again, as I said, depending on your activity levels also, the surgeon may change the implant he would like to use. So yeah, there will be some restrictions to your activities when you've undergone a surgery of replacing your joint. I'm sure your surgeon will be telling you that you're not to do any high contact sports. You can do, but you should avoid, because they will tend to wear your joints faster. So like you are not doing running, you are not doing jumping, anything that will give too much or excess of stress on your joints is to be avoided. Secondly, for a few months you will be asked not to sit on low sitting. after doing a hip replacement or after doing a knee replacement. And again, as I said, this will be little specific as per the implant as well as per the surgery what the surgeon has done. If your hip or knee is very stable, maybe you will be able to do it later on, but things have to be avoided when the joints are new. Sometimes what happens is what we call as the forgotten joint, especially after doing a hip replacement. Many patients forget after maybe around 4-5 years that have undergone a surgery, and they tend to do everything that is possible that can be done. So, but still it is better that some restrictions need to be followed as per the specific instructions of your surgeon. Especially after a hip replacement, you have to keep your legs apart by keeping 2 pillows between your legs. While turning also, you need to take certain precautions that your leg remains away from the center of the body, and these precautions need to be followed as per your surgeon's instructions. After a knee replacement, as I said, the commonly asked question is whether I can bend my knees and sit with folded legs. So that again depends on what implant has been used, and also it depends on how much knee bending you had before surgery. If your knee was stiff to begin with, it will be difficult for you to maybe bend your knee post surgery. And maybe post shoulder replacement, it again will depend on for what it was done, for how you are going to do your physio and recovery. So restrictions of your movements may be a little more than what you would expect it to be than compared to your hip and knee replacements.